This video is absolutely going to be, for the most part, limited or demonetized simply because of the subject matter. Even though I'm not really covering the coronavirus, this is more of the media information and why you should get your sources from multiple sources. Many sources have reported now that the lead doctor, Li Jiming, dies after getting infected. From the Mirror, he was dead. From the Herald, they said he was dead. From LB, they said he was dead. However, the reality of the situation is he is not dead. He is being resuscitated and still receiving treatments. Head of Wuhan hospital who caught coronavirus is still having treatment, say health officials, after Chinese mainstream media had reported that he had died. A Hubei health official said the head of a Wuhan hospital is still being treated after media reported he had died of the novel coronavirus. Dr. Li Jiming from Wuchang Hospital is undergoing resuscitation after failing critically ill, according to the social media account of a director from Hubei Provincial Health Commission. The conflicting reports resemble the coverage of the death of Dr. Li Wenliang, who was punished for sounding the alarm. Yes, he sounded the alarm. He was sought out and hours later was arrested. And then, well, he did end up dying. He sounded the alarm with the coronavirus and lost his life to the disease earlier this month. Dr. Li's hospital denied reports of his death, only to declare his passing in the wee hours the very next day. Because they have to get clearance, man. They have to have Uncle Sam. I don't know what the Chinese version of our uncle would be, but yeah, they needed his permission. Do we declare him dead? Do we call him dead? Do we call him dead? I'll almost guarantee it. The move caused an outpouring of fury from the public who accused the hospital of covering up the truth. Of course they were covering up the truth. They needed clearance. They needed permission from their version of Big Brother. That's what they needed. They didn't want to get in trouble with the government. By last Friday, the novel coronavirus had killed 6 health workers and infected 1,700 medical staff in China, according to Beijing. The virus, formerly known as COVID-19, has so far claimed at least 1,775 lives and infected more than 71,440 globally. Quite drastic. The news of Dr. Liu's death was first reported by Red Star News. Red Star News, a news outlet based in Chongqing, said it had confirmed the news from multiple sources, which is what you should always do. Confirm the news from multiple sources. I had these on my radar for quite a while, but I explore Chinese social media. I look at a lot of videos there. There are a lot of people that work in the hospitals, or at least some of them claim to work in the hospitals. There's no way for me to vet them. But based upon the way they speak, and translation is kind of weird sometimes, but you can kind of get a general idea of what's truthful or not. I did not report on him dying because, well, there were reports that he wasn't dead. So, here we go. Get your news from multiple sources, people. Multiple sources will help you out. Don't read just headlines. Get into the news. Ask questions. It's okay to ask questions and say, hey, Google, is this guy really dead? Red Star News is a news outlet. One of its insiders was the director of the Propaganda and Education Center of the Hubei Provincial Health Commission. In a post on Weibo, the Chinese equivalent to Twitter, the official announced Dr. Liu's death. Part of the post read, "Mourn the first hospital director to have sacrificed himself." Red Star News also spoke to an unnamed doctor at Wuchang Hospital who told the newspaper that he was saddened by Dr. Liu's passing. Another insider said Liu had always been a healthy man and that he was surprised by the news of his death. About an hour later, the official from Hubei Provincial Health Commission claimed that Dr. Liu was still being resuscitated. He said that he had deleted his previous post after hearing from Dr. Liu's family. The official then explained that he had learned about Dr. Liu's death from a mutual friend of him and Dr. Liu. You can't just go and say, hey, this is what happened. You got to get multiple sources. I know. A friend is the best mechanic. I know. I got a mechanic. He's a friend. I know. Sometimes you should stay away from friends when it comes to things like that. The official then, Wuchang Hospital is yet to comment on the report. So far, the most high-profile medical worker killed by the coronavirus has been Dr. Li Wenliang, who worked at Wuhan Center Hospital. The ophthalmologist caught the public's attention after he was reprimanded by police. He wasn't just reprimanded, he was picked up, flat out arrested and questioned, and accused of spreading fake news for warning people on social media of a SARS at a Wuhan seafood market on December 30th. His post came 2 weeks before the coronavirus broke out in the city of 14 million, which has been locked down since January 20th. It's something like 70 million people now are locked down. He was declared dead by his hospital staff in the early hours of February 7th, after the management of his hospital had denied earlier reports of his death. I always hate to report on death. I really, 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 really do. A little bit of an interesting one down here in the corner of this map, if you will look here. 10,844 individuals have actually recovered from the coronavirus. And that's good news. So out of 70,553 cases, there are 1,770 deaths, and 10,844 have been recovered. And it almost sounds like 2 weeks ago when I had reported that there were just news of, I believe it was 80,000 at the time, then they said 90,000. Now that number of cases has gone up because they have changed the way that they are reporting people infected with coronavirus. Before it was you had to have symptoms and things like that. Now they're saying, hey, you know what, let's expand it, which is a good idea. That's why the 70,553. But out of that, 10,844 have contracted the disease and recovered. Okay, it looks a little bit better then. But those are my updates. Get your news from multiple sources, guys. You guys are worthwhile. You guys are worth informing. Your lives are valuable. Your time is valuable. So if you're going to read the news, actually read the news and get multiple sources and hear some dissenting opinions and ask the questions like, really? I know they said that, but really? Anyways, that's what I got for you guys. I will see you guys on the next one.